Inlet and outlet of thorax. We have studied that the thorax is the upper part of the trunk, which is continuous above with the neck and below with the abdomen. So above it communicates with the neck and below it communicates with the abdominal cavity. Through the openings at the upper and lower end of the thoracic cavity, which are called as the inlet and outlet of thorax. The superior thoracic opening or aperture is called as inlet of thorax, and the inferior aperture or opening of the thoracic cavity is called as the outlet of thorax. So inlet is the upper opening of the thoracic cavity through which the thorax communicates with the root of the neck. Okay, inlet of thorax, which is also called as superior thoracic aperture. The inlet of the thorax is the upper opening of thoracic cavity by which it communicates with the root of the neck. Boundaries are anteriorly superior border of manubrium sterni, posterior superior surface of body of first thoracic vertebrae. Lateral boundary is formed by the medial border of first rib and its costal cartilage. Here is the upper opening, which is called as the superior thoracic aperture, and here is the inferior thoracic aperture. The boundaries of the superior thoracic aperture is formed by anteriorly is the upper border of manubrium sterni, laterally is the first rib and its costal cartilage, and posteriorly is the first thoracic vertebra. These are the boundaries of the superior thoracic aperture or inlet of thorax. Shape, it is kidney shaped. Dimensions, transverse diameter is 10 centimeter and anteroposterior diameter is 5 centimeter. Okay. Here the transverse diameter, it is 10 centimeter and anteroposterior diameter is 5 centimeter and shape is kidney shaped. Orientation, it is not completely horizontal. It lies oblique. The plane of the inlet is oblique and slopes downwards and forwards. Means the posterior part of the inlet of thorax is higher than the anterior part of the thoracic inlet. Anterior part is 3.75 centimeter below the posterior part. It makes an angle of 45 degree with the horizontal plane. The inlet is closed partially by suprapleural membrane. Here is the orientation of the inlet of thorax. It is oblique, okay, making an angle of 45 degree. Here, making an angle of 45 degree with the horizontal plane. And its distance, the distance of the anterior part from the posterior part is 3.75 centimeter below the level of the posterior part. Okay, the anterior part is 3.75 centimeter below the posterior part. Okay. So this is the orientation of the inlet of thorax. And this inlet is closed partially by a membrane called as the suprapleural membrane or the Simpson's fascia. It's also known as the Simpson's fascia. The part of the thoracic inlet on either side is closed by a dense facial sheet called suprapleural membrane or Simpson's fascia. It is tent shaped. It separates the thorax from the neck. Here, partially the inlet is closed by a fascia which is called as the Simpson's fascia or the suprapleural membrane. Its attachment are posterior end is attached to the transverse process of seventh cervical vertebrae and the anterior end, which is broad, is attached to the inner surface or inner border of the first rib and its costal cartilage. Attachments posteriorly to the tip of transverse process of C7 vertebra, anteriorly to the inner border of first rib and its costal cartilage. Its inferior surface is related to the cervical pleura, covering the apex of lung. Okay. Below it lies the upper part of the lung, which is called as the apex of lung. And apex of lung is covered by the pleura. And the part of the pleura covering the apex of the lung is called as the cervical pleura. Okay. So this part, okay, the inferior surface of this suprapleural membrane, it lies immediately above the cervical pleura. And so it is called as the suprapleural membrane because it lies above the pleura. Okay, the inferior surface is related to the cervical pleura covering the apex of lung. Functions of the suprapleural membrane is it protects the underlying cervical pleura beneath which lies the apex of the lung. Okay, so this is the first function because above now here it is continuous with the root of the neck. This part is quite superficial. Okay, so it protects the underlying cervical pleura below which lies the apex of the lung. Second function, the important function is it resists the intrathoracic pressure during respiration. During respiration, there occurs the expansion and relaxation of the lungs. Okay, but this expansion and relaxation of the lungs, it is not seen in the neck because the suprapleural membrane, it resists the intrathoracic pressure during respiration. As a result, the root of neck is not puffed up and down during respiration. That is the main function of the suprapleural membrane. Next, structures passing through the inlet of thorax. Inlet is partially closed by the suprapleural membrane, and whatever opening is left, whatever passage is left, the structures are passing from the neck into the thoracic cavity or from the thoracic cavity into the neck. What are the structures? We'll see muscles. The muscles passing are sternohyoid, sternothyroid, and longus colli muscle. Sternohyoid and sternothyroid muscles. These are the muscles arising from the posterior surface of the manubrium sterni and are inserted into the neck. So they are passing from the thoracic cavity into the neck through the inlet of thorax. Longus colli muscle is the deep muscle of the back lying in front of the thoracic vertebrae. So this also passes from the posterior part of the neck into the posterior part of the thoracic cavity through the inlet of thorax. Next, arteries. Right and left internal thoracic arteries, brachiocephalic trunk, left common carotid artery, left subclavian artery, and right and left superior intercostal artery. All these arteries, they are passing from the superior mediastinum, that is from the thoracic cavity into the neck through the inlet of thorax. Then nerves are right and left vagus nerves, left recurrent laryngeal nerve, right and left phrenic nerves, right and left first thoracic nerves, right and left sympathetic chains. Okay, these are also passing from neck into the thoracic cavity. Veins are right and left brachiocephalic veins, right and left first posterior intercostal vein, and inferior thyroid veins. Then lymphatics, thoracic duct passing from the thoracic cavity into the root of the neck. Other structures that are passing through the inlet are esophagus, trachea, right and left domes of cervical pleura, apices of right and left lungs. Okay. Esophagus and trachea, they are passing from the inlet of the thorax, okay, from the neck into the thoracic cavity. And this right and left domes of cervical pleura and apices of right and left lungs, they are not passing, but they lie in the inlet of thorax under cover of the suprapleural membrane. Okay, so they are considered here. Next, the outlet of thorax or the inferior thoracic aperture. The inferior thoracic aperture is broad and surrounds the upper part of abdominal cavity. Boundaries are anteriorly is the xiphisternal joint, posteriorly is the body of 12 thoracic vertebra, and laterally is the costal margin formed by costal cartilages of 7th to 10th ribs and 11th and 12th ribs. The boundaries of the outlet of thorax anteriorly is the xiphisternum or the xiphisternal joint. Laterally is the costal margin formed by the costal cartilages of 10th ninth, and eighth rib, which are attached to the costal cartilage of seventh rib and through it to the sternum. So this continuous margin, costal margin, and the 11th and 12th ribs. Okay, these forms the boundaries of the outlet of thorax. Okay, costal margin formed by costal cartilage of 7th to 10th ribs and 11th and 12th ribs. And posteriorly is the 12th thoracic vertebrae. Then the thoracic outlet is closed by a large dome-shaped flat muscle called diaphragm, which separates the thoracic cavity from the abdominal cavity. Okay, the structures from the thoracic cavity, they are separated from the abdominal cavity by a transversely placed muscle called as the diaphragm, and structures passing from the thoracic cavity into the abdomen, they pierce the diaphragm, makes openings into the diaphragm to enter into the abdomen. Okay, most of the structures, they are entering from the thoracic cavity into the abdomen. Okay, so this lower boundary of the thoracic cavity, lower opening of the thoracic cavity is called as the outlet of thorax. And most of the important structures, they are entering from the neck into the thoracic cavity through the upper opening of the thoracic cavity. So the upper opening is called as the inlet of thorax. Okay, so that is all about the inlet and outlet of thorax.